Hi, okay, so today we're going to be talking about specimen management and how we handle putting them into containers and shipping them off to wherever they need to go. So first off, we start off with our lab forms. As you see here, we have three companies that we go through. We go through IDEX, Abaxis, and Antec, and I filled out the Antec one. As you can see, we have our client number right here, our doctor, the client's last name, and the pet. So Keely is a canine. She's a husky mix. She is spayed, and she's about 5 years old. Along with that, we have our clinic name and address. So if they need to send anything back, they have that available for us. So whenever Antec requests anything for lab work, we fill out any of this. So if Keely were to be getting a wellness today, she would be getting her PWR, or her pet wellness report, and we would check that off accordingly. Now, whenever we do her wellness or any type of blood work, we need to collect urine that will be sent out in this, her EDTA, and some serum to send out. Now, normally we just we spin down the red top tube to get some serum off and replace it. And what we will do, we will put the Antec form into our bag, and we will put our tubes accordingly what we need into the bag as well. Now, if we are doing some type of avian culture, we will put slides into our slide box and send them out also. We also have biopsy containers, large and small. And whenever we start to head out into the postal, we pack with ice, with an ice pack. We put it into the box, pack everything as tightly as possible so nothing gets jostled around. Most of the time we put our blood work out into our blood work box so the companies are able to pick it up in the afternoon. And that is also, we need to put an ice pack into the box as well if it is hot outside. And that's how we do our specimen management. Okay, so I'm going to be demonstrating an ELISA test. So this, we've already collected our sample from our patient, and that the syringe was pre-heparinized. So we have our heparinized blood, and I'm going to add 3 drops to our little test tube and 4 drops of conjugate. And close up our tube. Mix gently. And we're going to add it to our test. And the blood is going to rise. And as soon as it gets to this little hole, we're going to snap our test. Okay, as you can see, the blood is starting to come through, so I'm going to go ahead and snap it, and the solution is going to wash through and give us a either negative or positive result. Okay, as you see here, our ELISA test shows negative, so in that takes normally about 8 to 10 minutes to get this result. Hi, okay, so today we have Rowdy here, and I'm going to be getting an ear swab off of him. I'm going to break this one because it's the left ear. Lets me know which one I've done. Now I'm going to go ahead and put it on the slide. Normally do the left ear first. Then the right ear, and we make sure to roll it out. Make sure we don't get big chunks on there. We'll fix it. Now I'm going to stain it in the difficult solution. And into the last solution.
I mean, seriously, within like 2 hours. I mean, now Max still itches occasionally, but nothing like what you would.
Rinse that off as well. Dry it off with the paper. Okay. After that, I'm going to be examining the sample. I'm going to put it under a microscope. I'm going to put it under 100 power right now so I can focus onto the left side. Okay. Now that I've got a good siding, I'm going to go ahead and put the oil immersion on. Put a drop, and then go to the oil immersion. And I'm going to focus in on my sample. And it looks like we have at least 1+ yeast on the left side. Doesn't look like there are any cocci in the sample. And so you can see, it looks like we have yeast in our sample.
Hi, I'm Dr. Robinson. This is Megan. We're going to do a necropsy on this little puppy. He's a 4-week-old male puppy. One of 2 in a litter. The other litter mate is perfectly healthy. This puppy came in yesterday severely hypothermic, dehydrated, had not been eating well for a couple days, and passed away shortly after we instituted therapy. So we have him already opened. You can see thoracic cavity, abdominal cavity. So basically we're going to start with the abdominal cavity, and I'm going to go ahead and make an incision in the diaphragm just to be able to see a little bit better. Get that out of the way. The diaphragm itself looks normal. Okay, so starting at the front,